We feel all the time fatigued by monitoring our sleep, metabolic marker, the calorie burnout. And at the end of the day, we feel very fatigued rather than informed. Body needs to be trusted. It does not need to be surveyed all the time. I want us shifting our focus from data management to health and wellness management. We need to break this anxiety loop that overtesting had created and truly start enjoying our life.
Welcome back to Intentional Medicine with Dr. Singh, the podcast where we explore what it truly means to design health inside a system built to manage disease. Today, we're talking about something that most patients and even most clinicians assume is always a good thing: more testing. From annual lab panels to advanced diagnostics, wearable trackers, and direct-to-consumer tests, we're surrounded by more health data than ever before. But more data does not always mean better outcomes. So today's conversation is about rethinking the role of testing in modern medicine and what it really means to use it intentionally. And hi, Dr. Singh. It's great to see you as always. I'm excited for this episode. How's your day going so far?
It's going great. Thank you so much, Lella, for having me here.
Awesome. And I think this is such an important episode. I think that we're often tested for so many things. And as a patient, sometimes we don't even really realize what the diagnostics are testing us for. So it's such a good conversation to have. So let's dive in. I'm excited to get started. So my first question is about why people assume that more testing is usually better. So why do you think that people assume that more testing automatically leads to better health outcomes?
So, Lala, we live in a culture that equates action with progress. And ordering a test, that feels very proactive, responsive, and sometimes scientific also. But remember, data without interpretation is just a noise. So the test you do and the result that you obtain through those tests is not seen as insight. But we live in a culture, we live in a society, particularly this time where we have AI and so many other tools available to us so easily. We live in a mindset that the more is better. And we assume that every test catches something meaningful. But here is a problem, that the every test also has a risk of giving you some incidental finding or false positive result. So this mindset that the net you cast wider always catch big fish does not apply to science, because our body biology is not that clean. So when you multiply tests across dozens of markers, you are virtually guaranteed to find something abnormal. Perhaps that means nothing clinically, but you are setting yourself or guaranteeing, some of those abnormal tests. So the real question should not that, what can we test for? Real question should be, what are we trying to understand? And does this test help us understand that? So I think what we truly need is shifting framing from volume to intention, because that is everything in intentional medicine.
And at its best, what role should diagnostic testing really play into medicine?
But we have to remember that testing is what exactly? Testing is a tool. It's a tool that sharpens our clinical reasoning. It is not here to replace it. A well-chosen test confirms a hypothesis. It helps us to rule out some differentials, or it also helps us to track a trajectory over a time. But testing is now seen as a solution. Just think like a compass. If you know where you are trying to go, a compass is invaluable. But if you are standing in a field with no destination in mind, a compass tells you nothing. You're just going to spin around. You are not going to get any useful information through that compass. So testing is exactly like the compass. A purpose-driven diagnostic test give you a value only if you start with the clinical story. So the patient sitting in front of me tells me, give me a guidance, what test I need to order, because they are giving me a narrative there by saying that, hey, doc, my weight is not budging me despite doing everything. I'm not sleeping well. I feel tired whole day. So those questions, those history are, the true narratives that guide what test we should use, because they tell us what differentials are we trying to achieve here. So the test, they should be specific, they should be targeted, they should be interpretable in a clinical context. The test, they are in service of understanding, but they are not in there to replace our clinical reasoning.
Absolutely. And I think that that was such a good comparison too about regarding the compass, because exactly sometimes we could be testing, but if we're not looking for the right things, then we're not going to get the right answers that we need. When
Exactly.
when or where do you think that testing starts to become excessive or even maybe counterproductive in clinical practice?
Great question, Lela. Overtesting begins when testing ordering is driven by anxiety. A clinician anxiety about, missing something that perhaps can lead to any medical legal situation, or patient's anxiety about, wanting certainty. They want to know what is happening in their life or in their health when they have some vague system and vague symptoms in place. So the testing become over when you don't have a defined clinical question. You are trying to just get some answers. And in that situation, it is not served as a tool. It become kind of lottery that, you just want to try and just look, oh, perhaps something meaningful I will get out of, this plethora of, the test that I'm going to order today. Um, Today, you see that there are certain comprehensive wellness panel that have 100 to 200 biomarkers, and sometimes they sound thorough and useful. They are not the same thing. So when you order 200 biomarkers, perhaps you can have 10 to 20 results that are flawed, mean they are uh, perhaps abnormal, and sometimes they are not abnormal because they are just as an incidental finding. But what you have done by ordering those unnecessary tests is that you have given 20 reasons to the patient to worry about. And that is not science. And the other thing I just want to say that the testing also become counterproductive when it substitute for foundational work. I see patient, these days, they come with uh, the folders with, 100 to 100 tests, but they have a zero clarity what is truly happening with their health. And at the same time, they don't talk about, what foundational work they are doing towards their health. Are they sleeping enough? Are they eating, good food or nutritious food? How are they managing their stress? Are they moving, doing some exercise? So these are some of the foundational work that kind of sideline when we are too much focused on testing. And the other thing that over testing sometimes create a dependency and confusion. And remember, that is not an empowerment. The testing should help us to empower our patient in their wellness journey, not to substitute any foundational work that will support their health.
And what happens when patients receive abnormal results that may not actually be clinically meaningful?
Lala, that is the most underappreciated harm in medicine, a false positive test, or we also call it incidental finding, which is not clinically significant because it triggers a cascade effect. So one abnormal test result leads to follow-up test, a specialist referral, sometimes even an unwanted procedure. And suddenly a healthy person enters into a clinic now enter in a medical odyssey which was initiated by a number that perhaps was never truly a problem. It was just an incidental finding. But the most insidious part is that this cascade, it erodes the trust in the body. Now, the patient or the client or a person who start relating their body as a problem to be solved rather than system to be supported or health to be optimized. So the abnormal test or a incidental finding, totally change their narrative around their health. The other thing that also want to, focus on that any abnormal test also require clinical context, not a reflexive action, because that what I have seen, particularly at the consumer testing platform, that any time when you have an incidental finding, then the people or client, they start ordering, they have a reflexive response, they start ordering more and more tests. So the interpretation, that is a skill, and that require years of expertise to individualize that particular incidental finding or false positive result to give you a precision. And who can do that? A expert, a clinician who has gained, the experience over the year. They know how to differentiate a clinically significant value from a noise. So we have to understand that the false positive result not only have um, the what we call that, that it require a lot of other resource in terms of doing more testing or resources, financial resources, but the most important resource that I'm talking about, your time, your peace, and your health.
Absolutely. And I think that speaking about that and ordering all these tests, especially if they're not all totally necessary, can really cause anxiety for the patient. I know that I've been in a similar situation recently, and they wanted to do some heart testing, and I was really concerned. I'm like, what's going on there? And it wound up being nothing, but that also I think can drive anxiety in patients. And that actually kind of leads to my next question as well, because how does overtesting impact patients psychologically?
Yeah. That's a great question, Leila. And you just shared your personal experience. So, overtesting create an anxiety loop. And that is very, challenging to break. So the pattern is a patient who feels uncertain about their health, they get tested. And then one result or couple of results, they get flat. What happened that the uncertainty deepens, and to resolve that, you test more, you seek more tests. So the tests, they are not reducing anxiety. In fact, they are feeding your anxiety. And I think that is the most challenging part. Now, these day patients, they wear all these wearable.
Hmm.
So what is happening? I have seen patients, they check wearable data every hour. They feel unwell when a metric is out of range. You eat something and all of a sudden your glucose monitor show you out of range value, and you stop enjoying the food, or you stop enjoying the feeling that you had because of perhaps your favorite food you just ate, and you start thinking or worrying about the glucose level. So now that your every lifestyle decision are based on those wearable data, and you cannot do anything without consulting your biometrics. So right now, is happening that the data, they stop informing about your life. They have start governing them. And this is where I find that our biggest challenge lies. This another very important thing is happening because of all these, wearable data that we have easily available, or the consumer testing that we do, that they have created some sort of the phenomena, what we call a hypervigilance fatigue. So what is happening that we are paying so much attention to these data that we forget how to enjoy our life. We feel all the time fatigued by monitoring our sleep, monitoring our metabolic marker, monitoring our the calorie burnout, and at the end of the day we feel very fatigued rather than informed. So one thing I just want to say, that the body needs to be trusted. It does not need to be surveyed all the time. So I want us shifting our focus from data management to health and wellness management. So I think somewhere we need to, break this anxiety loop that this data have created or over testing had created and truly start enjoying our life.
Absolutely. And I have heard a lot about that from clinicians who have patients and know people that use the wearables. It does really drive anxiety and cause anxiety in a lot of cases because you're so concerned with the data and the metrics. You're not even focusing on other things. Your mind is just focusing on that. And you get so exhausted because you're
Yeah,
constantly
yeah.
thinking about the data. Even I have a sleep clinician that I work with, and that's mentioned a lot. People are so focused on their wearable data about sleeping that they're not even able to sleep. So it is such an anxiety loop in so many different ways. And
You just mentioned this, Lela. I remember other day one of my colleague, mm, uh, and she was telling me that, I'm not feeling well today because I didn't have a deep sleep. I said, really? I mean, what happened? Was something bothering you? Or she said, no, I went to bed, normally, but I didn't have a deep sleep. I said, how did you know that? She said, because my wearable told me that. So you see, like how now the data is interpreting that how are we gonna feel in a given day. So because data told her that she didn't have a deep sleep, that's why she already assumed that she's not gonna feel fully charged today because she didn't have a good sleep.
that's so interesting. And the whole day, she'll probably be thinking about that and
Yes.
convince
Yes.
herself that she doesn't feel great or up to the way she should feel, whether or not she actually feels okay or not. It's all like a psychological way of,
Yes.
changing how you think about things. And you often distinguish between normal and optimal. So, how should patients think about lab reference ranges?
You know what? Thank you, Lela, for asking this question. Because these days, the traditional medicine for a very long time, relied on reference ranges. And I really want to make a difference here because we are attempting to move our traditional care to upstream and make it more intentional. So remember, what is a reference range? Let's talk about that. So reference range in uh, any standard lab test that you take is population data. So what exactly they represent? They represent a statistical average of the people in given sample. Lot of time they are not even a healthy, optimal, functioning people. Sometimes they are sick people. So when the result is within the range, what exactly test is telling you? You are being told that you are not a statistically outlier, but that doesn't mean that that given lab is optimal for your biology because your biology can be very different and it depends upon or it starts from how you are exactly feeling in a given. So let's take an example. A TSH level, the test very often used to check the thyroid hormone or thyroid gland functioning. And the thyroid hormone is one of a very crucial or important hormone because it regulates functioning of so many biological system in our body. So one of the biomarker that we use to see whether our thyroid gland is functioning optimally or not is TSH level. And it ranges somewhere between zero point 0.5 to 4.5. So just imagine someone who has a value of zero point 0.7. We are saying that you are same as another person who has a value of somewhere around 4.3 or 4.4 because they both are going to be labeled as normal. They fall in a reference age. But in reality, what is happening that the patient or the client or the people feel very different when they lie, at the particularly at the end of the margins of these reference range. So what I want to say here, the normal is acceptable for general population, but we have to see what is optimal for a given person. So a patient who's sitting in front of me telling me that I'm feeling fatigued whole day. My weight, I'm gaining weight. I'm cold intolerant. My hair is getting thin. I have no energy at all. And if the level is somewhere around 4.2, 4.3, or even 4.5 of TSH level, I'm not going to accept it as a normal, because I am going to read that level in context of patient symptoms and give the support that patient is truly need in a given situation to have a optimal thyroid health. So this is where I feel, intentional medicine, differentiate that it does not focus too much on normal reference range. We always look for the optimal lab value in context of where a patient lie in their health journey and where they are heading in their wellness journey.
And absolutely, that's such a good point that you made. That's interesting because everyone is so different, and someone can, now I'm learning, you can have similar lab numbers but feel completely different. So why is that? Why can the same lab value mean something so different depending on the person?
Yeah. You know, in medicine, the context is everything. So number on a lab report is just a snapshot. It's a single data captured in a living dynamic system. I hope biology is that simple, but you know what? That is not. So without context, that lab value or lab report is almost meaningless. We human beings are very complex. We are interaction of our genetics, our history, our lifestyle, our environment, and dozens of other factors. The test, the day you get your test, what kind of the sleep you had, what food you ate, were you NPO, means you were fasting that time when the test you got. So these are some small, but very powerful question that we need to ask anytime when we are interpreting a lab test. I'm giving you another example. A ferritin is a very important test, that tells about the iron reserve in your body. So the low ferritin in a perimenopausal woman who is a pure vegetarian planning to run a marathon and very active, having a irregular period because she's in a perimenopause stage. But the same ferritin value or low ferritin value has a different meaning in a postmenopausal woman who is just enjoying her life and got that, finding as during, I'll not say the incidental finding, but during her routine checkup. So you see that these two patients are very different, and the low ferritin value in these two patient group is tells us very different stories. So not only that, even the given test can have a different value at a different stages of your own wellness journey. The low ferritin at child producing age in your 30 to maybe 25 to 35 carries a different value
Mhm.
versus low ferritin in a perimenopause or menopausal stage. So that's what I was just trying to say, that I hope the science is as simple as math, but in reality, that's not. 2 plus 2 is always here, not 4. You have to interpret that lab report in a clinical context. But another thing I want to bring here, that why I'm saying that lab report is a snapshot, because trends matter more than a single value. A
Mhm.
patient who's just take another example, a patient who has like, inflammatory marker that come into a normal range. But if I look at that lab value over a period of time, and if I see that the marker, they are slowly creeping over 3 years, they are telling me a different story. They are, even if they are in a reference range, but if you started from the low end of that reference range and now you are at the upper end of reference range and you are having some signs, symptoms also, that you are feeling fatigued, you are feeling inflamed, and now your markers are also creeping, I have to intervene, because your trends are telling me a different story, that you are not on a right trajectory and I should intervene. So even for every individual, that range is different. That range carries a different meaning at a different stage of life and at the way they are, shifting or moving in a given period of time.
Absolutely. And like you said, there's also so many factors that go into that, into something for an individual person. So it's important to also take that into consideration, different lifestyle and trends. And just that snapshot's just an indication of kind of where to navigate to almost, it sounds like.
Right.
And what's your perspective on direct to consumer testing and, like we were mentioning earlier, wearable health data?
I'm glad again that you asked this question because we slightly touched upon, consumer testing and wearable data. And I'm just saying that I genuinely, appreciate the way the science has evolved. Consumer testing has become such a powerful uh, tool. It has democratized access to health data, which is genuinely empowering. I see patients who never would have known about vitamin D deficiency, elevated CRP level, insulin resistant. Now they are catching all these things early and they are bringing those information or data, into a clinical discussion. I think that is a net positive for health literacy. And consumer testing has made that only possible. The wearable data like the continuous glucose monitoring, they have completely transformed the metabolic health world. The real time glycemic response to food, stress, sleep, they have changed, they have modulated the client or the people behavior in a way that nutrition lecture would have never done. I remember giving, the bundles of paper to patients or client and, giving them the value of the healthy eating or the how they have to, have a nutritious diet, particularly diabetic patient. We have a full lecture on, the on diet and nutrition for the newly diagnosed diabetic patient. But the impact that I'm seeing of this continuous glucose monitoring is way more than the lecture that we used to give them. So these tools are very powerful. But the area which I mentioned earlier also, and I want us to be careful about that, the misuse. These days, we are also misusing this data and we are substituting it for the clinical judgment. So, I am seeing patients are coming to me and they are on various supplements. They are also on some medication. They are ordering hormone panel and they are self-treating based on the result without any clinical context. And I think that is the area where harm is occurring. So, you know what? The empowerment comes from understanding these data. They are very powerful, but we have to make sure that we are using them with responsibility because the data does not, the access doesn't mean that they are also the responsible me. They are very important tool for health literacy only if we use them responsibly.
Absolutely. And I think like what you said is something that I've been hearing a lot in the health world is about the misuse of handling the data. And I have a question about that too in regards testing. So do you think that too much testing can actually interfere with someone's ability to improve their health?
Oh, yes. Oh, yes. That is the other, change I am noticing in people behavior. So the common pattern I'm just seeing that suppose a patient who has a poor sleep, not eating very nutritious food, not moving around. We all know that these days we all have a very busy life. So what is happening when patient, they are not feeling to their best, they go and they order test either to clinic or even, all these consumer testing platform. You get the result. Some of these results are suboptimal. Let's take, you have ordered a hormone and your DHEAS is low, or your omega 3 index is not within the reference range, or your HSCRP is elevated. So what you start doing, you just focused on these three, particular biomarkers, and you start putting your all energy fixing these biomarkers, perhaps taking omega 3 supplement, taking DHEA supplement. One thing what you are missing here, that you are still not sleeping well, you still not taking the nutritious diet, you are still not moving around, not doing any sort of workout, and you are still stressed out. So what is happening that you are too much fixated on these abnormal tests that you started completely ignoring the foundational. So the testing in this context has kind of become an avoidance mechanism because it provides you the feeling that you are taking some action, because you are taking some supplements, or even just getting the test seems like you are, you know, taking some action
Mm-hmm.
without requiring the discomfort of actual change that is needed in first place. You need to get up from your chair and move around, do some exercise, change your, sleeping pattern. But we are ignoring because we are over testing, or we are in this assumption that we are doing something. So I again want to stress upon the importance of foundational intervention. We cannot, any test cannot replace the foundational work that we need to do on our sleep, our nutrition composition, on our stress regulation, or our movement. Trust me, even the foundational intervention, they don't require single test. The testing is just a measurement tool. If you are not doing the work that you are supposed to do, they are not going to take you anywhere. So sometimes even I tell my clients, hey, you know what? Pause on these testing thing and let's spend coming 3 months on your foundation work and make our way up to these testing, because the testing result will be very different from what they are today if we truly focus on our foundation work rather than on the test. So I think the testing, they are only tool and we should see them as a tool because they don't move your health up or forward. You need to do the foundational work to achieve that.
Absolutely. And from, let's say, the patient standpoint, which is my standpoint, I think that you said that exactly right. You go to the doctors, you get your lab work, you feel like you did something right. You're like, I'm taking care of myself. I went to my appointment, I did the lab work. But if there's measures that need to be taken after that, it's easy for them to not always happen, but you feel accomplished or like you did something right by just going to do the testing. So that's interesting to think about. And how would you say, or yeah, so how should someone think about testing in a more structured and intentional way?
Lala, you know me so far. I like a framework. I don't like doing things just for the sake of doing, or doing them haphazardly. I believe in framework because framework provide you a context. Framework provide you a structure. So before testing, in our at Athena Wellness MD, we use a testing framework and we ask four main questions. So the first question that we ask, what specific question are we trying to answer through this lab test? So, the are we trying to look, find whether, confirm a hypothesis or reject some differentials, or we are testing because patient is coming to us have a significant cardiovascular risk factor as a family history. So you should have a specific question in your mind that you are trying to achieve or to answer through this test. The second question that I always ask, that how will the result change your approach? Suppose if the result, the value is higher than the reference range, so-called reference range, or the value is lower than what you want it to be there, then what are you gonna do? If the test come back high or low, what truly gonna change? And trust me, if you are unsure about that what you are going to do with that result, I suggest not to order that test because that is not going to help either you or patient. It's only going to add anxiety and cascade of many more tests and sometimes unwanted procedures. The third question that I always ask, is it the right moment to do the testing? So the context and timing, they are not a simple variable when it comes to testing in healthcare. they are very powerful questions that we need to ask because timing means a lot in healthcare. Timing, just take a simple example, cortisol level. You know that the cortisol level, it fluctuate in your body. So testing cortisol morning versus afternoon versus night has a different interpretation. And not only that, if you are not sleeping well, suppose a patient coming to me and was in a very stressful situation, didn't sleep well for last couple of days, if I'm going to test the cortisol level at that time, the value gonna give me entirely different story versus the same patient in a normal situation, that cortisol carry a different value. Not only that, someone is sick like thyroid, hormone get fluctuated by how you are feeling in a given moment. If you have a fever, if you are again inflamed, the thyroid value can be different than you being in a normal situation. So that is very important that when are we testing the patient, it has to be in a normal situation that will give you the best result. The last thing is, what is your baseline? Because as I mentioned earlier, a single test is just a snapshot. It a data point that does not give you a full story. But the longitudinal data that tells us where your health was and where it is heading toward. So it gives me a trajectory, and based on that, we can build your health and wellness journey. So it helps to build a picture over the time. So it's very important, the testing. Before we order the test, we ask all these questions because that gonna influence the outcome or interpretation of that test. So the essence of intentional medicine is intentional diagnostic. The test has to be with purpose. It need to be interpreted with context, and we need to act with clarity because that is what the intentional medicine teaches us.
Absolutely. That's such a good point because I think that I've never been asked that when I go to the doctor about, uh, questions surrounding the testing day. Did you sleep well last night? And there's days you can go to the doctor and for an annual not feel well or not have, like you said, slept well the night before or even the night prior to that. And that can change your lab results. And where is your baseline? That's such a good question. And that's why this is such a good podcast about being intentional and having that mindset around intentional medicine. And this was another great episode of Intentional Medicine with you, Dr. Singh. And today's conversation has been such a reminder that more information is not the same as better health. And because data without context doesn't create clarity, it actually creates noise. Because the goal isn't to measure everything, it's to understand what matters and act on it. And that's such a good lesson and message to have. And if you're enjoying the show, make sure you subscribe, follow, and join us as we really rethink what medicine can be. Thank you again, Dr. Singh. This was a great episode, and I cannot wait to continue the conversation and see you next time.